Hi there. My name is Dr. Craig Rodriguez Sejas. I am a licensed clinical psychologist working here at the University of Michigan. And if you're looking at this video, it's because you have some interest in our study on the comprehensive assessment of psychiatric experiences among LGBTQ plus individuals. My goal is to tell you a little bit about the study, a little bit about what we do in my lab, and hopefully then you can decide whether or not you're going to participate in our study. I do hope you'll participate because I think the data we can gather is extremely valuable in helping us better understand the mental health needs of LGBTQ plus folks. So, what to expect from this video? It's not going to be too long. I'm going to tell you a little bit about the study, about the hierarchical taxonomy of psychopathology, or HiTOP, which the studies are kind of based on, what to expect, our incentives and compensation, and to thank you very much for watching the video, whether or not you decide to participate. So, the hierarchical taxonomy of psychopathology is an emerging psychiatric system to improve upon the limitations of the Diagnostic and Statistical Manual, or the DSM. It's based on more than a decade and much longer of research at understanding what are the domains and the dimensions that undergird or underlie our typical diagnoses that we talk about. I'm an executive committee member of the HiTOP Consortium, which is an international group of scholars and mental health practitioners and experts worldwide aimed at trying to improve our system of diagnosis, assessment, and treatment. I also co-lead the Diversity, Equity, and Inclusion work group within the consortium, where our specific goal is making sure that underrepresented populations are included in the work of the consortium to make sure that we're doing the best job to understand mental health for all folks. Now, in the past couple of years, the HiTOP Consortium has created a measure that really is all-encompassing and comprehensively assesses different domains that we think are really important to better understanding mental health that aren't always captured in every single diagnosis label. The goal of this study then is to ensure that we have appropriate representation of LGBTQ plus individuals within our data as we move on improving and trying to do better at assessing and treating mental health. So I'm going to show you a little bit about the HiTOP model looks like and walk a little bit through it. Lastly is the SPLAT lab, which I run, the Stigma Psychopathology and Assessment Lab here at the University of Michigan, where our goal is to better understand the mental health needs of folks from underrepresented groups and how different environmental factors relate to that. This is the HiTOP model. It might be a little bit confusing, but just let me walk through the pieces I think are important. In the red box at the bottom of the model are the typical things we think about when we talk about mental health, usually psychiatric disorder diagnoses. So you'll see in the middle things like borderline personality disorder, GAD or generalized anxiety disorder, or MDD or major depressive disorder. Above the box, though, are all these different domains and dimensions, like internalizing, externalizing thought disorder, and their components that we think are really important. These are the things that undergird those different diagnostic labels. So we've spent a lot of time trying to create an encompassing, a comprehensive measure that gets at these different domains. And that's what we're testing out in this study. We want to collect sufficient data from LGBTQ plus folks to ensure that we have enough information to include in our samples to better understand these different underlying components. First to use to improve treatment, assessment, and diagnosis. So if you decide to participate in the study, what can you expect? You're going to be asked a variety of questions about your mental health, about alcohol use, different life experiences and behaviors. And we just want you to select the response that best corresponds with your experiences. There is no right or wrong answer for any of these questions. But as you answer these questions, please pay attention to the time frames. They'll be a little bit different. So I'm going to give you a couple examples to show what this might look like. So you might see instructions like this. In this section, you'll be asked to respond to a number of statements about your thoughts, feelings, and behaviors. Some of these things are pretty common, whereas others are less common. As you respond to the following items, please consider whether there have been significant times during the last month when the following statements apply to you or your thoughts and beliefs. Please select the option that best describes how well each statement described you or your thoughts and beliefs during the last month. And then you see an item like this. I lost a significant amount of weight without even trying, and you can choose between not at all, a little, moderately, and a lot. And what would you like you to do then for these items is think about, in the last month, how true has this been of your experience? And then you select the response that you feel best appropriately corresponds with your experiences this month. You might get other questions like this. In the next section, you'll be asked about how you have felt or acted most of the time since early adulthood, regardless of the situation or whom you were with. Do not include times when you were not yourself or when you acted differently than usual because you were depressed, hyper, anxious, nervous, drinking heavily, using medications or drugs, or experiencing the bad after effects, or times when you were physically ill. And then you might see a question like this. Have you often become frantic when you thought that someone you really cared about was going to leave you? And so for this type of question, we'd ask you to think about in your adulthood, when you're your normal self, not if you're experiencing a severe depressive episode or something like that. Does this describe you generally, something that you experience? Now, compensation. We don't have a lot of resources. So we don't have any guaranteed compensation, but we do have resources that we're able to pull together for various raffles. So once you participate in the study, complete the study without failing the attention checks. There are a couple of those built in just to make sure you're paying attention. They're very easy just to gauge your attention as you're going through the study. You'll be entered into a raffle to win one of 80 $100 gift cards. If you're chosen, then you'll be able to get that that gift card at the end of the study, and my lab manager will be in contact with you at the end. I do want to end off by saying thank you so much for watching this video and for your interest in this study. Your participation is extremely important to us to ensure that LGBTQ plus folks and their mental health needs are considered as we improve the psychiatric diagnostic system. If you're interested in more of our work at the Stigma, Psychopathology, and Assessment or SPLAT Lab, you can check out our lab website if you look for the SPLAT Lab at University of Michigan, and you can see a bit more about the type of research that we do right now. Thank you for taking the time to watch this video and participate in our study. If you have any questions, you can contact us, either Lindsay Gibb, my lab manager, using the Spectrum Study at UMich email or her personal email, or you can contact me directly as well. So I want to thank you so much for this. Your participation is extremely helpful for us and meaningful for us. Thank you.